Hello, everybody, and welcome back to the Physician's Mind podcast. I'm your host, Curtis Wilkerson. I'm an incoming medical student, and I created this show in effort to engage the curious mind and give successful people a platform to share their experiences and advice to help you optimize your journey of lifelong learning and self-improvement in medicine and beyond. Today, I have the pleasure of speaking with Advaith Thattai. Advaith is an incoming medical student with an incredible journey shaped by resilience, curiosity, and a passion for mentorship and patient care. Born in India, he later moves to Puerto Rico and then Michigan, experiencing firsthand the challenges of low-income communities. He pursued a degree in biomolecular science at the University of Michigan, where he excelled academically with a 4.0 GPA and an excellent MCAT score. Beyond the classroom, Advaith has dedicated himself to hands-on patient care as an EMT in underserved areas, mentoring students nationwide, and even founding a national initiative to support aspiring medical professionals. His experiences span from research, teaching, and clinical work, and ultimately they're all tied together by his passion for education and medicine. I'm excited to dive into his journey and the lessons that he's learned along the way. So Advaith, thanks so much for joining me today, my friend. How you doing? You want to tell us a little bit about yourself?
Yeah, thank you. Couldn't have done it better than that. But yeah, so obviously my name's Advaith. I go by AT at times. But yeah, like as you said, I started my journey in India. I then moved to Puerto Rico and then finally Michigan, which is where I currently reside. It was a great, foundation, right, to, how I think and, everything that, I know really and what I'm passionate about. So yeah, currently, I'm looking to work more in the mentorship space and the teaching space, just because I love it so much. Love talking to students and improving their journey. Usually, typically with the mindset of trying to go to medical school, because that's probably what I'm best at right now in terms of helping. But I spent a lot of time in undergrad, really thinking whether do I want to go to medical school or do I want to go into the teaching route? And what I kind of ended up learning was both of those things are things that I love, and mending them or connecting them in some way is really something that I look forward to.
Beautiful, beautiful. So where are you in life right now with school or work or your other endeavors?
Yeah, so right after I graduated, I started working in research a little bit, but then I actually got registered as an EMT. It took a lot of work, and I know, I'm pretty sure you're also an EMT. So that was really fun. Got, great chance to work both in kind of like an academic teaching setting, but also, in clinical medicine. So that was really awesome. But right now, what I'm most excited about is, starting this, this venture where we help students, across the country in their own pre-med path. So that's kind of where I'm at right now. I think that's probably the best way I could say it.
Awesome, Advaith. And see, that's exactly why I wanted to connect with you, because I knew from your LinkedIn page when I first discovered you that you were an entrepreneurial guy. And that entrepreneurial mindset, I think, is a beautiful thing in medicine and in life in general. I always appreciate guys that are generative by nature and trying to make the most out of the resources they've got. So tell us more about your business endeavors, my friend.
Yeah, so it wasn't always like that, actually. I wasn't personally always, with the idea or mindset to let me go create something on my own that's at least profitable to any degree. It actually all started with, when I was in undergrad, I couldn't find a particular org to help students in literacy education. That's what I was really interested in, because I struggled with language, for a long time. I was, I guess, even classified as low literacy level in India and Puerto Rico. So I couldn't find it. So then I ended up just creating an org that did that, because I was like, okay, it would take a lot more time and waste of my time for me to actually do stuff that I'm not as interested in, but within the same niche. So that kind of, over time blossomed into what I'm doing now, right? Which started in literacy teaching. After, that ran its course, I thought, what else can I help students in? It's pre-health. I'm really good at learning about, what it really takes to be competent for medical programs, right? So then I went into that, and then, it wasn't until really last year where I was like, I love doing this so much, and I've been doing it in the nonprofit sense, right? Which it really was. We were helping a lot of students, where I was like, hey, maybe I can actually turn this into a potential career. So I wanted to give it a try. I'm really glad. And you asked about what the endeavors are. It's, we've in essence constructed an online interface that allows students to track their experiences, to get their GPA, data, all visually presented in a very beautiful way, calculating their science and non-science GPA, tracking their applications, and their interview invites, consider it a one-stop shop for all things tracking for pre-med. And on top of that, we offer, services as well, where we help students with whether it be one-on-one mentorship, whether it be MCAT, interview prep, or application prep. But that's always obviously if students want that. But most of the site is free.
Awesome. That's very cool. And something that piques my interest as well. So how many languages do you speak?
Yeah. So I speak 3 languages very well. And then 2, I don't even know if it would be insulting if I said I can speak them even moderately. Okay. But the 3 are English, obviously, Spanish, because I lived in Puerto Rico, and then Telugu, which is my native language from India. And then Hindi and Tamil. My dad speaks Tamil as his native language. And then Hindi is just spoken by most people in India, and both my parents speak it. But I'm not as good as those 2, but yet I can understand them. I can understand Hindi a lot more than Tamil though. So 3.
Wow. Yeah, I think that is extremely badass, man. That is very cool.
Yeah,
especially as a guy who's going into healthcare, I think you'll have some interesting potential speaking so many languages to maybe even do some overseas medical missions with Doctors Without Borders or something like that, considering that you speak Spanish.
That's actually one of my biggest interests, to actually work with patients who actually don't speak English as their primary language. Obviously, the ones that I'm good at.
Nice. Very cool. So, we've talked a little bit about your business endeavors. What is I want to kind of talk about your vision for not only your business, but kind of your life in the next 5 years or so. So I guess we could start with the business. Where do you want the business to go? Or, we could call it, where do you want the organization to go? And where do you want to end up in the next 5 years?
Yeah, it's a good question. So, I guess starting all of this, I really wanted to, improve as a person overall. There was a lot of, deficiencies I had, perhaps in the speaking sense and the leadership sense. I mean, I really wanted to improve that. So in the next 5 years, hopefully I can get just a little bit better at each one of those things. But, with the actual business itself, what I want to do, I have 3 core tenets, really. Okay. So, and there's one of them is something I feared is, starting medical school. Would I, be able to, I don't know, afford it? Would I be able to, just have like some kind of job? Because I've always had a job. So with that, our first tenet is to try to make a good income for medical students in medical school, right? What they can do that's low stakes, that's very flexible. That's one tenet and pays well. The second one is I want to offer it as much free resources as I possibly can to the people who need it most, right? So I think what we've noticed is in this particular domain over the past, let's just say 10 to 20 years, is a lot of companies capitalizing on the top 1% earners, and which is okay. It's just it just leaves a lot left to be desired, right? And a lot of people left unhelped, right? And there's a lot of, and you know better than anyone, there's so many components in this process, and a lot of it is behind this cloak that is very easily revealable, but only by those who actually are able to unveil it, right? With people with that knowledge and that strength. And I think knowledge is power. So with that, we, as our team, people who are very well versed in this pre-health space, are able to unveil that cloak to the people who need it most for free. So that's obviously our second thing. And then number 3 is to really just provide, one-on-one actual advising. College advisors, they can be great. High school advisors can be great, but the keyword is can, right? So the thing is, I want to try to eliminate that the perception where a lot of students have, where I can't really go to my advisor. They don't really understand the route. They didn't really give me the best advice. I think it's much more beneficial to directly target medical students or people who have been through the process in recency with the students that need that help, as opposed to people who are just trained on it. So that's those are my 3 big goals. In the next 5 years, we hope to, I know this is a bold claim, but I hope to be the first and last website where students start their pre-med journey and end it.
Beautiful. So effectively what you want to do is offer affordable, high quality resources for students that need guidance from competent people.
Correct.
Nice. That's a great thing. Where can somebody, if somebody who's listening right now is interested in learning more about it, is there somewhere they can go to check it out, or is it still in the making of the website development and whatnot?
Yeah. So right now, obviously, we've been working on this site for, several months. We've been through 2 beta testing cycles now. Last year, we did it on a much more rudimentary platform that was already on a third-party hosting platform. So it was very easy. We didn't have to make anything. But what we've been doing right now is obviously we have job postings on LinkedIn and whatnot and all the other various avenues, but I think the best way to reach me is probably directly via LinkedIn or email right now. But eventually, when we have our actual postings live on the site, you'd be able to just go to noblevita.com and just apply through there, which will be actually within the next month or two.
Great. And we'll be sure to include some of that info in the show notes for anybody who's interested in checking that out. So my next question for you, my friend, is what is it do you think not only motivates you every day to work hard and to produce these great things, but what do you think are some of the habits that consistently lead to your success in academics and beyond? I know you like to work out. You got a great study routine. What do you think are some of the consistent things that you do on a day-to-day basis that lead to your success, and what do you think motivates you to do that?
Yeah, first I'll start with what motivates me, right? So, when we were in, we started in India, it wasn't, we didn't really have a great upbringing in terms of, we didn't monetarily, the resources weren't great. The opportunity wasn't great. And obviously as a child, I didn't really notice this. I just tried to enjoy life for what it was, right? But, growing up, I really noticed it by virtue of seeing my parents and how they really struggled. So, moving from, India to Puerto Rico, it was heartbreaking, right? Because you leave everything behind. We didn't exactly go to a great place in Puerto Rico, but I saw the best in it nonetheless. But what I really noticed is each day that went on, I could see my mom's strength withering away, but not in front of me. And that's really powerful. So, I saw how hard she worked to get us through life, to, support us on a very low income. And then when we moved to, rural Michigan, it's like the same thing. We just felt like we started over. But in reality, it was a stepping stone to move forward. And that was something she worked really hard for. So my motivation comes from obviously seeing my mom basically start at the lowest of lows and then now reach a point where she's very proud of herself and comfortable. So, that's honestly what I look at. And I really use her as a role model. I think there's a lot of role models in my life that are, just very powerful women that I've seen really, really beat the odds, if you will. Right. So that's my motivation. And number two, the second thing that you asked, which was, how do I consistently maintain that, that motivation, right? That's more important, right? So, it's actually an ongoing battle. I can't say I'm perfect, right? Because I go to the gym, I want to say about 80% of the year, maybe 70% of the year. I don't go 100 though. But that's 70 to 100 where I'm at least there several times a week. If I do miss a few days. The gym has been a huge part in that because it maintains routine. That's number one. Number two is actually something I did drastically different this year, which is normally I would sleep. I thought an appropriate bedtime was between, 11 or midnight. I thought if I sleep at 11, that's very early. But, what I found is that that's actually quite late in my routine now. So what I did was I drastically changed it to 6 to 8 p.m. And it sounds like a weird thing to talk about, but waking up now, if you're sleeping between 6 and 9, you're waking up, between 3 and 5 in the morning, right? It just, it's changed my life drastically because I wake up every day on time. And if I wake up late, I wake up at 5 or 6. That's my late. You know what I mean? So doing that every day. And I did this starting this year, which is every morning I record a vlog of myself talking about my updates of what I'm going to be doing that day and what I've been successful in over the past day. And I do that. They're all private. I unlist them on YouTube, but they're for myself. And I do a daily kind of like journal, and I keep a to-do list and calendar on a daily basis. So doing all those things and having a regimented schedule has really helped me maintaining the drive to achieve my goals.
6 to 8 p.m. That might sound outrageous to someone. And then I think it's so funny how you're like, yeah, when I wake up late, I'm waking up at 5 a.m. That's awesome. And beautiful story, about your mother's resilience, about her grit to provide for the family, right? It's hard going through moving across such large distances so many times. And I love the vlog thing, keeping your self-awareness up to date, kind of keeping track of your stuff. I personally keep a journal, and I think it's a similar thing. Just having that vlog, whether it's you're writing it down, whether you're speaking it on a video, it's great to keep track of where you're at in life. And just ultimately keeping that disciplined routine, the sleep schedule is critical, man. So very interesting to hear some of those things, right? Because it's different for everybody. I always love asking what people's habits are. My next question for you is going to be, why medicine in particular? What led you down a path of the medical field?
Yeah, it's a good question. When I'll be honest, when I started, undergrad, I was just very curious to explore everything a little bit, right? So, I knew that like teaching after my first year, right? So I continued doing that, but, I was very, very interested from high school, in just science in general. So I started doing that. I started, taking all the more critical classes, which is like biochem and organic chem. And I did enjoy it, actually. But one thing that I was just like absolutely infatuated with was the teaching component. I just love teaching. I'm like, on every spare second I could get in my day, I just wanted to teach people, seriously. So, I mean, so much so I did it for free for 5 years, right? Hundreds of students, just completely because every day I couldn't live without it, right? So it was almost something where I was like, okay, I'm probably going to end up being a teacher, because I mean, I love it that much, right? But then I started actually, taking the advice of some of my friends, and they were like, hey, look into, a few other things, right? So, it's funny. I worked in like the restaurant industry for a little bit. This was during high school, or not high school, undergrad. And then I did my little tour of, what finance is and trading. And I looked a little bit into engineering, tried to learn some code. So I basically did like a rotation, if you will, with everything. And then I started, during COVID, there was a severe shortage of, what's it called, of people to do COVID swabs and nurses. And there was a shortage in every domain, right, that you can think of. So I was like, okay, well, I don't really have much experience and I don't really have any cert. So what's the best way to help? I was like, okay, maybe I can just give a hand to my school doing COVID swabs, because I learned that you don't need to be certified to do that. So when I started doing that, I was like, wait, this whole patient thing's kind of cool, because what is similar between teaching and medicine, right? And in the regard that you get to speak to people all day and you get to actually teach them something that they don't know, typically. And it was really cool. I was like, this is very similar. They're asking me questions about, albeit they were asking me questions about when they would get their test results, or perhaps what certain things meant, if they were positive or negative, what they should do. Nonetheless, I had an idea of what to tell them. So I continued that on, and I was like, okay, well, U of M, because I went to Michigan, their hospital system's like right next to where I live. So I was like, why don't I just look for opportunities there that don't require a certification? So at least I don't invest too much if I don't like it. So then, I started patient sitting, and I was like, this thing is great. Like I get to sit and talk and assist patients on a daily basis, but I also get to teach them about my life, though. It was like, I was almost like I was talking to them about myself, because they needed a companion. In that process, that's where I can answer your question the best, because that's where I learned that the inpatient hospital setting is a place that's very interesting. And, I think this data I've been keeping up on is that when you, don't quote me on specific numbers, but when patients are appropriately engaged and made, their inpatient setting is made to feel like as at home as much as possible, they actually tend to recover faster. They tend to have, much better mental health coming out of it. And those are, just even those two components were just so interesting to me, right? So actually speaking to people, sharing knowledge would be able to improve their life so significantly. The one piece that was missing, though, is, a lot of the patients that I was seeing, like, they were coming from nearby areas, which weren't necessarily low income. I obviously did have low income patients, but it wasn't consistent. And I've always wanted to relate to patients more as much as possible, because I think that's where the best education comes from. And I think simultaneously, that's where the best medicine comes from, right? I go to an Indian physician myself. So yeah, with that being said, when I started doing EMS, right, where I could exclusively work in low income settings, answer questions, and also do on the spot care when I respond to 911 rescue calls, right? I learned that, this is something where it's not, in a weird way, it's actually not even patient care in the popular sense, where you treat them for their condition, but you're almost treating their soul as well. I'll give you an example. A lot of my patients are geriatric. When I worked in EMS, and a lot of them just never had people to speak to. And when we came along, some of them, we would transport, several times a year. So I'd see them often, let's just say. They'd be excited to see us, kind of like we're just their pals. And it would really make them happy in that regard. I know I mentioned a lot of things, but, simultaneously I was teaching as well. And one parallel I learned is, and it's important for me to define this part, teaching and mentorship are both things that I'm very interested in, and their intersection with medicine. Now, mentorship is very similar to teaching. Obviously, you're more of a guide now. That's more long-term, perhaps. But that's kind of what medical training, from what I've observed via shadowing and done, gone to many hospitals, is you're always going to be a mentee to somebody. But you will always also be a mentor to somebody else in the medical field, which I just loved. So a way to merge these two interests of, both teaching, where you can educate patients on, their conditions, educate patients on preventative care, which is what I'm interested in, by the way, and be a mentee to mentors who would be your senior physicians, your attendings if you're a resident, and, if you're a medical student, it's your resident, and so on and so forth. Yeah, all of that really inspired me to mend both of those based on all my experiences. So yeah, I hope I answered your question. I know I gave a lot of detail, but I guess in one sentence, I was able to mend both of my passions, which is teaching and patient care, by pursuing medicine.
Very well said. Very well said. Something so nuanced as to why you wanted to go into the medical field requires an in-depth answer like that. I think it was a great answer. I mean, it's awesome. That's very cool. Obviously, let there be no doubt that you have thought deeply about where you want to go in life and why you want to do it. So
yeah, I agree.
From the outside looking in, I think you're going to have no problem getting into medical school and succeeding. But obviously, you want to remain humble. You want to continue to put your nose to the grindstone, because there's obviously no guarantees. But I think you're going to be very successful getting into medical school. And that being said, what are you most excited about in the future now? Where you're at now, what are you most excited about here moving forward?
Yeah, what am I most excited about? Well, I'm doing something right now for the first time that I actually for years just didn't think I was capable of, which is trying to spread my passion to more than just, 100 people. And I'm not saying that's a bad thing, but it's a big undertaking where you can start a movement or start a revolution. And that's, I know I haven't done that yet, but that's what I envisioned to do. So what I'm most excited about actually is to try to radically change the face of education. That's my ultimate goal, particularly in the pre-health space, in the medical space. But I've basically had so many, subpar, let's just say, interactions with people who are supposed to be mentors, like advisors or counselors, which are people who are actually critical in the lives of students, right? And the lives of, prospective doctors as well. So my goal is to try to create this movement where resources are shared and not kept behind either paid walls or gate kept in a way where they don't need to be, where aid, consulting, or mentoring or counseling, whatever you want to call it, advising, is very readily available to every student that needs it and wants it. I'm most excited about spreading all of that help to, as many students as I possibly can. But it would be foolish for me to say that that's the only thing. I mean, that, and I'm very, very, very excited. I'm almost like itching to be an M2, M3, so I can start doing rotations and start really diving into the particular niche that I'd be really interested in teaching other patients about. So I would say those two things are what I'm really excited about. Actually, I think overall though, what's encompassed, what all of what I've said has encompassed is the idea of personal growth. And I think that's what I'm most excited about as a recurring theme from both of these things that I mentioned.
Any insights, anything you think would be worth sharing with the audience that you've maybe learned along your journey so far or otherwise?
Yeah. So many, but let's think of, I'll think of the ones that are probably the biggest things. Number one, I think, is ego, actually. Your ego in the sense of humility, right? And that's what I'm speaking of. It's very easy to portray yourself or even think of yourself as, someone who's very happy with their accomplishments. But there's a difference between that and obviously being a little overbearing at times, or perhaps seeing yourself in a heightened sense of self, right? And I think it's something that even, it plagues me. I think it hurts everybody, right? To a degree. But trying to control that is very important. How do you do that? And I think there's a few ways, right? You obviously have to be very grateful for the things that you do have in life, and also surprisingly be grateful for the things you don't have in life, because everything you don't have is a reflects on your character. You can use it as your strength, and everything you do have, you can use to propel the other side. So yeah, number one, I would say is that. Two is always be curious. I think it's very important, not only in the sense of trying to learn new information, but also curious how to modify aspects of yourself. I think this is I think life tends to be a game of, or a journey or a pursuit of trying to be one's best self and trying to make the most impact to those around them with the skills that they have and with the passions and interests that they have. With that being said, always being introspective, right? Always seeking out new information, trying to learn about how the ways other people experience their life so that you can be, empathetic and understanding to other people, be equitable, right? To really, to be inclusive, right? To how other people think. So yeah, I would say those are the two, I guess, controlling your ego and also being introspective and curious. Yeah.
I like what you said about controlling the ego and maintaining the humility and being grateful, not only for what you have, but for what you don't have, because what you don't have reflects on your character, and what you do have can be utilized to propel towards the other side. Gratitude, I'm a big proponent for gratitude in all situations. I think regardless, whether or not you're in a painful state or in a pleasurable state, you should be grateful regardless. And that's a beautiful thing for you to bring up. And maintaining that curiosity and being malleable in all situations and thinking beyond your own immediate self-interest and thinking in what ways you can maximally serve others on top of that. Beautiful.
Absolutely.
Beautiful advice.
Absolutely.
So awesome, my man. Thank you so much for joining me today. I really enjoyed our discussion. Thank you so much for joining me today. I appreciate your time, and I think your wisdom is going to lead to a lot of great things. So thanks again.
All right. Thank you so much.